Are you suffering from any elbow pain right on the side of the elbow right here? It's a lateral epicondylitis, and it's an inflammation or an overuse injury over the extensor tendons of the forearm. So I'm going to show you what to do about it today. So the first thing we're going to do is we're going to loosen up all of that fascia and all of that muscle and tendon tissue. I want you to grab a ball. I'm going to put it on a raised surface, a table or something like that. I want you to take your elbow. So we're going to put the ball right on that muscle. So this muscle right here. And what we're going to do is we're going to roll through there. You're going to arrive at a point that's going to be a little bit sensitive right there on the elbow. In this position, I want you to stay there, and I want you to bend and extend the wrist a few times. Right on this point here. Roll around a little bit, get all those sensitive areas, really roll through the tissue. Spend 2 minutes doing that. Second thing we're going to do is we're going to loosen up all of those muscles that are creating extra tension on the elbow and causing the extensors to work harder than they need to. So first thing we'll do is we'll do a tricep stretch. Just follow me. I want you to take a band, fixate it on a rack or a lowered surface. From there, we're going to pull that up and over the head and just lean into that stretch. Hang out here for around 1 to 2 minutes. Once you're finished, just let go. Yeah, you should be feeling a really nice stretch going through the back of the arm here. Next thing we're going to do is we're going to loosen the flexor tendons on the opposing side of the forearm. So if these are really tight, then of course these ones have to work extra hard as well. So really simple. We're going to stretch the hands. I want you to grab the fingers with the other hand. We're going to extend the elbow and push the fingers down towards the ground. Hold that stretch 1 minute and relax. Third thing we're going to do is we're going to start loading the elbow. So really important when we have a tendon injury is that we progressively load the tendon itself. When you grab a dumbbell, you're going to come onto the table. We're going to place the forearm on the table so that the hand is just hanging off the edge of the table. Elbow should be bent at 90 degrees. I want you to raise up with your other hand. So we're going to raise into the extension. From there, I'm going to take over the movement with my right hand. I'm going to try to hold the position here and then slowly lower it down all the way through the full range of the motion. Take it again with the left hand, raise it up, same thing, slowly lowering. The weight should be pulling the hand down, and this muscle is working against that. It's resisting the movement. I want you to do 3 sets, 8 to 12 reps. Take roughly 60 seconds rest in between those sets. If you want, you can also work the opposite side as a preventative measure for any future injuries on the other side. If you find that this itself is too difficult, what we can do is we can make the exercise even easier. We start with an isometric hold, so a static hold. We're going to come into the same position and we're just holding that position. Hold, 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 hold. We're going to hang out there 30 seconds. So 3 sets, 30 seconds, 60-second rest in between each set. I want you to get a stick of some sort. There's a weighted stick or a hammer. A kettlebell works as well. What we're going to do is we're going to bring we're going to hold the stick near the bottom. Obviously, depending on how much weight you want, you can hold it higher up for less weight. Lower down is going to be producing more weight. Then I want you to hold it in this position. So the elbow is bent at 90 degrees. Arm is into the side. And we're going to slowly lower down. What we're going to do is we're going to slowly lower down into this position, catch it with the other hand, bring it back into the starting position, and slowly lower it down again. This is working the supinator supinator muscle. It's the muscle that does this. It also has an attachment point up here on the lateral epicondyle of the humerus. Then from there, it's exactly the same thing. We're going to drop it down the other direction here. Take the other hand, help it up. If you're using a hammer, you can do this with your hand on a box or a table and bring it back up again. 3 sets, 8 to 12 repetitions. Work the other side in your rest period. It's really important to remember that this is not a complete rehab plan. These are just some exercises that can help you reduce the pain and increase the loadability of your tendon. For a complete rehab plan, it's really important that you speak to a health professional and a physiotherapist, or come down and see us at Halle 41 in Zurich.